Okay, it is, what is today? July 19th, 2023, and I am here with Zoe, and Zoe is here to give a testimony for her experience or testimony for going through our Spinal Rejuvenation program. I guess, Zoe, to start off with you specifically, would you kind of just tell, what do you do for work?
I'm a professional dancer for work.
Yeah, you're a professional dancer and own your own ballet company.
Yep, I founded it. Yep.
That's awesome. And then could you just kind of describe kind of what you were dealing with maybe before you came into the office? And it's okay, you were a patient here before we did this program as well. Also,
Yeah.
could you just elaborate on that a little bit?
Yeah. As a dancer, I see a lot of body wellness type of folks, work with a lot of different people. Came here originally for chiropractic work, which I think almost all athletes and dancers need. However, we were finding that chiropractic was not enough for chronic back pain that I was having. And when I saw a doctor, he was telling me, oh, I could get some vertebrae fused and maybe that would get rid of my back pain, or do some surgery to kind of numb some of my nerves in my back. But as a professional dancer, I need all of those things and I need all of that feedback from my body.
Yeah, and so as far as what kind of level of pain were you having, and then were you diagnosed with any kind of condition specifically at all?
I wasn't diagnosed with anything specifically. What we had understood through my x-rays here, my chiropractic x-rays, is that some of my discs were smaller than they should be, especially in my lumbar spine. But I wasn't only having pain at work. I was having pain with like very mundane tasks, like picking something off of the floor was excruciating. I wouldn't bend at all at my hips. I do a lot of housework, and I was noticing that even picking up the hamper to bring down the laundry to do laundry was excruciating, and it would put me out for a day. So it was really affecting just my day-to-day life as well as my professional life.
That's fantastic. Thank you for that. And so yes, you tried some chiropractic, some massage therapy. Are there any other modalities or treatments that you had tried in the past as well?
Yeah, I tried lots of things. My massage therapist, I've worked with him for a long time, and it was something that he was saying, I don't think massage is enough to get to the root of this problem. So then I went to physical therapy. I have a physical therapist that I've seen for a long time. And again, exercise were helping strengthen, but not helping the issue. Through that, I tried trigger point dry needling, which is kind of a spin-off of acupuncture, cupping, muscle phasing, which is a different type of muscle work, and everything would help for a certain amount of time, and then it would go back to just being painful.
And so after the fact, now that you've went through the decompression, the spinal decompression therapy, in addition to the series of exercises that we've given you, compare and contrast before and after.
Yeah, I was really skeptical going into the program at first because I had tried so many things, and I think my pain had lasted about 3 years. So I was skeptical going into the program, but within a month, I forgot to think about, like, I have to bend over to pick something up. I need to brace myself for the pain that's coming. That started to just kind of like become a non-issue. And I remember telling everyone about, it's very simple. This is what I do every week. I do these exercises every day, and I was feeling my body release. And I still do my exercises, if not every night, every other night. And I haven't had any lockup, any what I would used to call an episode where I couldn't even walk properly, since I started the program.
So if you were to say something to somebody watching this video right now, kind of considering what you do, and what advice would you give them?
You have to try something first. You can't judge something just on its base. So I would encourage them, if they've never tried chiropractic, try chiropractic first, see how that feels in your body. But you do have to trust the process. Obviously, exercises are really important. The whole program works together, hand in hand. And if you start the process, I think very quickly you'll start to feel the changes and the effects of it. For me, it was an intense 3 or 4 months to get started, but since then I've been able to do exercises as I need, and it really has been able to recalibrate my whole system. So my advice would be jump in and try it.
Fantastic. It's videos like this that change people's lives, Zoe, so thank you.
Yeah.